First of all, I would like to ask Professor Tasci to give a short overview about the development of Turkish endourology for us. Sayın Hocam, Türk endurolojisi nasıl bir gelişme göstererek günümüze gelmiştir? Bir kısa özet yapmanızı rica ediyorum.
Yani dünyayla birlikte gelişiyor. Yani farklı olarak düşünmemek lazım. Daha önceki açık cerrahiler laparoskopik olarak veya diğer yöntemler Türkiye'de de eş zamanlı olarak geldi. Bu şeyde 2 yıl içerisinde 80 kursumuz oldu. 80 tane birebir kurs, bölgesel toplantı. Bu gelişmeler hızla devam ediyor. Türkiye mesela taş konusunda dünyanın herhalde en sık ülkelerinden bir tanesi. Taş konusunda endoskopik tedaviler konusunda da makaleler olarak hem uygulamalar olarak oldukça iyi bir yere sahip. Açık cerrahi artık dünyada birçok yerinde olduğu gibi Türkiye'de de yapılmıyor. Bu bakımdan Türkiye enduroloji konusunda tıbbın diğer alanlarında olduğu gibi oldukça iyi bir yerde.
The Turkish Endourology Society has developed a great deal in the last few years in parallel to the developments in the world. Endourology has the advantage of using technology, particularly in urinary tract stone diseases. And in Turkey, urinary tract stone diseases are frequently identified and seen. And with the help of the very well organized structure of Turkish Endourology Society, we have organized more than 20 courses in the last 2 years that includes endoscopic management of urinary tract diseases and in addition all fields of endourology. The development of endourology in Turkey is very similar to the development of endourology in the rest of the world and particularly in the developed countries, including robotic surgery and all sections of endourology. We are actively performing endourological applications, and compared to the let's say 10 years back, we are not doing any open surgery very frequently, but most of the time we are applying endourology in urinary tract stone diseases, in urinary tract cancers and the rest of the urological conditions.
Not 20, 80.
So I'm making a correction. We have organized more than 80 courses in the last 2 years, organized by Turkish Endourological Society. Teşekkür ederim. Thank you very much. I would like to ask my question to Professor Balbay, who is the president of this meeting, and also Professor Fatih Atug, who is the secretary of the meeting. I would like to hear your comments about 11th National Endourology Congress that's being run in this nice hotel.
Actually, let's start from 2 years ago. We have decided to organize this Congress as an international Congress. Despite the fact that its name is National Endourology Congress, it has become an international meeting because we have speakers from all around the world, including United States of America, Canada, United Kingdom, Germany, and Romania, and United Arab Emirates, Iran, and Azerbaijan. We also have participants from at least 8 countries, including Azerbaijan, Iran, Iraq, Yemen, Greece, Egypt, and Qatar. Approximately, we have a little bit over than 500 participants attending to this meeting this year. We started to follow the endourology congresses in the last 2 years, which are held almost anywhere in the world, and worked on the program of this congress, and we decided what to include in this congress, looking at what has been discussed in other congresses or meetings. We tried to identify the hot topics and future topics. And I'm glad that there is a big interest among participants on the topics that are being discussed currently at this meeting. I'm happy to have international speakers who are also prominent and well-known urologists all over the world. They have started delivering wonderful lectures in their own fields, including endourologic procedures and also the EAU lecture on the use of MR fusion guided targeted biopsies in the detection of prostate cancer. So I think.
Thank you. Thanks very much for the explanation. And I would like to ask Professor Fatih Atug, are there any courses organized during this meeting, and what sort of courses they are? And do you think the younger generation has a great interest compared to the previous years to urology and endourology?
I think there is a great increase of interest to endourology. Every year, the Endourology Society in Turkey is getting bigger, and the contributors of this congress are more than 500 people now, urologists now, and probably in the next few years we will have more participants. What was the purpose of this meeting? Like Dr. Balbay told, we decided to make an international meeting in this congress. We decided to make Turkey as a bridge between Asia and Middle East and between Europe and United States. So we invited other urologists from Iran, Qatar, and Iraqi, and even other Gulf countries. And we invited from United States a very well-known urologist from Europe, and to make a connection in Turkey, and we will share the knowledge. So the main purpose of this meeting was to make a connection between Middle East, Asia, and other countries in Turkey, and international meeting. And regarding to your question, we have several courses, mostly percutaneous surgery, ureteroscopic surgery, laparoscopic surgery, like we do in most of our congress, endourology congress. I think the interest for endourology is increasing every year.
Thank you. And we have our fourth guest, Dr. Serdar Gozen. He's originally Turkish. He was trained in Turkey, but for the last few years he has been working in Germany, and he's our international correspondent. He contributes in our meeting a lot, and before me he was serving as the editor-chief of European Medical Journal of Urology. I would like to ask you a question about the E+ course and exam. What does this mean? And what are you going to do during the E+ in this meeting? And we know that you have organized a lot of courses in the field of laparoscopic urology, not only in Turkey, but also in other countries. Could you please talk about laparoscopic development in our country, in Turkey? And as a person that you have been working in a very well-known center in Germany, in Kliniken Heilbronn, you have been working with a famous professor, Professor Jens Rasweiler. Could you please compare the situation about endourology in Turkey with Germany and with Europe? Are there any differences, and are there any similarities? And what is the future of Turkish urology, Turkish endourology, compared to Germany and the rest of the Europe?
Thank you very much. We have started with laparoscopy training with a program, the standard program, and we are working in standardization of all this program to be able to serve and give this training as a standard in all over in the countries, starting in Europe. As we have started with the young residents in Prague in European residents training meeting every year, we have seen that's a big request about laparoscopy training. So 4 years before, we started with standardization of this training. We have started first with the basic training program, which is then just basic skills in laparoscopy. Thereafter, we are working now on the intermediate training program, and the last step will be the advanced training program before going to operate to the patients, to the humans. Actually, to develop a program, you need a structured, first structured exercises. You have to work on this. You need a lot of candidates. You need statistic. You need feedback. And at the end, you can put a program and then try to develop more or widen this program on the world. That's what we have done. It started in Holland. We have taken care first what's the standard training, what's the request of the residents, and then we focused first on the basic steps in laparoscopy, which is depth perception, bimanual dexterity, how to use the instruments, how to use the needle holder to bring the needle in different positions, just the basics. And at the end we come to 4 basic exercises. Most important thing was for us as an aim to be able to measure this exercise, to measure these performances with this exercise actually. And at the end, after performing this training, giving this training more than 2,000 residents, we reached a median level, which is the first the performance and then time limit. Thereafter we started to give this training also in international level. After 2 years we have seen that we will be able now to offer a certificate after a validated exam. That's what we have started now, and we are giving, after this validated, standardized training, basic laparoscopy training, the only one certificate on this world for basic training given after one exam, which is making this actually certificate so much valued, and people are so much interested to get it. And we are happy to be able to give this course here, and then we are happy to be able to make this exam at the end of the Congress. I'm grateful to all the organizers here. They have contacted us and given us the chance to be able to work with the young urologists in Turkey. About the training programs in Turkey and Europe, I think, as if you will think about 10 years before, we were really at the beginning, and this time was the pioneers' time in Europe. When I see today, we have reached actually the top level in the urology, and we can compare all our level, performance, and then also the scientific part, which is then published paper on the world, which is very comparable with all the European and American countries. At the end, Turkey was running, and in this short time we could reach this level. I think also for the future I'm very optimistic, as I have seen all this interested young urology, and as I have seen this support from the society and from the mentors here. I'm very sure that we will reach a better level in very short time. Thank you very much.
Thank you. And all of us sitting around this table are robotic surgeons actually. All of us are dealing with robotic urology for a long time, and we've got very experienced professors among us. For example, Professor Ali Tasci's department in Istanbul is one of the very first departments who has started dealing with robotic urology. So I would like to ask Professor Ali Tasci how they did start robotic urology and what's the future of robotic surgery in our country. Hocam sizin kliniğinizdeki robotik cerrahiyle ilgili kısa bir özet yapabilirseniz.
Yaklaşık 2000, hatta hatırlamaya çalışıyorum, 2009'dan itibaren robotik cerrahi yapıyoruz. Yaptığımız vakaların herhalde %95-%96'sı prostat. Robotik cerrahiden benim anladığım prostat kanseri. Öbür vakalarda çok uygulanmasını doğru da bulmuyorum, gereksiz de buluyorum. O bakımdan hani belki daha önce toplantı öncesinde de konuştuk, devletlik fazla kullanımıdır. Yani duyuyoruz bir takım robotları artık histerektomide kullanıyorlar, laparoskopik safra kesesinde kullanılıyor, şeyde kullanılıyor, varikosel yapıyormuş bazı arkadaşlar. Böyle olduğu zaman cost efektivitesi kalmıyor tabii. Yani robot prostat kanseri için sanki yapılmış bir cihaz. Gerçekten sinir koruma, kontinans koruma açısından çok daha üstün bir teknoloji. O bakımdan prostat kanseri için çok faydalı ve gerekli bir cihaz.
Kaç vaka yapılmıştır hocam? Tahmin olarak klinikte.
Galiba bezmaleme geçti, bir sene oldu. 500'ü geçmişti bizim vakalar. Şimdi Volkan devam ediyor. Bazı günler 2 vaka oluyor.
Herhalde 600'ü geçmiştir.
Geçmiştir.
Professor Ali Tasci's department has performed more than 600 cases since the beginning of 2009. So it's one of the central robotic surgery centers in our country. And he says the most effective application and most frequent application of urological robotics is in prostate cancer. You can apply robotics in other urological conditions, but he says, according to his opinion, it's most efficient in prostate cancer, and he does not think it might be very useful in other urological diseases, and he doesn't think that it's very cost effective in rest of the urological diseases. We know that increased cost is a disadvantage of robotic surgery. So I would like to ask and learn the opinion of Professor Balbay and Professor Atug about the same subjects. We know that you both are dealing with robotic urology. You are high volume surgeons, and apart from prostate cancer, in what sort of diseases you are applying robotic surgery?
Well, first of all, I have to mention that I agree and disagree with what Dr. Erdem Canda has just said. For some urology cases, you should not use robotics. There is no doubt on this, including varicocelectomy or nephrectomy or cholecystectomy or hysterectomy, which also can be done with the use of simple laparoscopy. But I'm also using robotic surgery in the treatment of several different uro-oncological conditions, including partial nephrectomies. And as you know very well, we have also done a lot of radical cystectomies and intracorporeal continent orthotopic bladder substitutions with the use of robot. I believe that as data accumulates, the efficiency of robotic surgery and the complication rates, lower complication rates, if these surgeries are done with the use of robot, will prove that the use of robotic Da Vinci system works, especially in such cases. But for the time being, I can say that partial nephrectomy is also a very good operation that can be done with the use of robot as radical prostatectomies. But there are some problems with robotic surgery. It's very expensive, and unjust prices of the medical equipment, utensils, and the technology or the maintenance makes it less useful for the treatment of many urological and other surgical procedures and other subspecialties. And the other problem with the Da Vinci system is that there is no competitor of the company, which is the single company in the whole world producing and selling this device at whatever price they want to sell. So we definitely and desperately need some competitors, and I'm sure in the future these competitors will show up and all the prices will go down. So many patients will benefit from robotic surgery when the prices go down to affordable levels.
I would like to ask a question to Professor Atug. So we heard that we use robotic surgery in prostate cancer and in bladder cancer and also in kidney cancer. Do you think is there any other application of robotic surgery apart from these diseases? And one other question is, as we have been applying robotics in a lot of urological diseases, the number of open surgery that we have been doing has decreased. Do you think does this has a negative impact on the training of the residents? Do you think that does this prevent them to learn open surgery, and would it be a problem not for now but for the future?
Yes, I think it will be a problem for the next generations in the future. Because I will give you an example. When I was in the United States between 2004 and 2007, I saw only one open case. Even in 2004, in Tulane University, the rest of all prostate cases were done robotically. So think about the generation, they are not doing any open surgeries. If something happens to robot, it breaks, fails, what will happen? They don't know how to do an open surgery. So that's a very big problem for the next urologists, next generations, I think. We should focus on training, video editing systems, on open surgeries also. That should be our duty and job. Because think about a surgeon who doesn't know open surgery, only does robotic surgery. This may have negative impact in the future. Second thing, what I believe, we shouldn't behave like company-driven urologists. This company is pushing most of the surgeons to do more robotic cases. I think there is one right argument in robotic surgery. This company shot the heart, hit the prostate. It fits very well in prostate. It fits very well in kidney. Dr. Balbay is doing very good radical cystectomy operations, totally intracorporeal. But I don't think that robotic surgery has a role in general surgery, in colon tumors, in gynecologists. And now they are pushing pediatric urologists, and now they are pushing ENT. I don't think that robot is doing a good job in ear, nose, throat diseases, and I don't think that it works in thoracic surgery. They are doing laparoscopic surgery, which is named robotic surgery. So we should select this. The company is pushing everybody to do more robotic surgeries to earn much more. They are earning a lot, they want more. But the time will give the answer. They will have no role in the future on these subspecialties.
Thank you. And I would like to ask a question to Dr. Serdar Gozen from Germany. Could you please make a comparison between the training in Germany and the training in Turkey and the training in Europe in the field of urology and endourology?
In Turkey, the mentality of the people are totally different. When we are comparing with a European resident with Turkish or Middle East resident, it's totally different expectations, totally different life planning. Accordingly, and totally different systems too. In Germany, we are expecting that the resident will learn what he has to do in the office, good diagnosis, good indication, putting good indication and correct indication, knowing the guidelines, and performing at least all the diagnostic procedures, endoluminal, it means including cystoscopy. But if they want to learn more, they have to stay in the clinic after being urologists. If they don't want to learn operating, they can skip and then go to the office, then take care for the patients before and after the operation. And this is also a very important part. The most important thing is everybody has not to learn or not to be able to do every surgery. But in our countries or young residents, they are really eager to learn all the laparoscopic surgeries very short time, which they will be not able in their future life. Learning laparoscopy is only important for the high volume centers and for high volume surgeons. You cannot perform a good laparoscopic radical prostatectomy if you haven't done more than 30 cases. if everybody will start with 30 cases and try to accumulate these 30 cases, in this meantime, we will lose maybe with 100 urologists 3,000 cases with bad oncologic results. On the other hand, we have to give this training. We have to give this training as a target training for the people who are skilled, who are interested, who want to stay in this scientific field. That we have to do in Turkey. In Germany, it's very easy. You learn everything. You learn all the diagnostic. You learn all the urology, including andrology, pediatric urology. This is also part of urology, and we may not forget this part. And he or she has to do a good diagnosis in the office and has to be able to send the patient to the correct center to be cured in the best way. Actually, in Turkey it's working well or not. They are teaching because we need our residents. They are helping us. They are trying to learn. They are inspecting everything. But this is not the solution to teach everybody in laparoscopic or robotic surgery, which is first, not possible. Second, will result also with bad memories at the end. Thank you very much.